My name is Dr. David Bradley, and we're going to discuss how your body actually heals. Here at Active Healthcare and Physical Medicine, it's really a big concern for people to know how their body is going to heal so that they can take care of themselves. The doctor's job is to assist you to recover when you've had traumas or injuries or spinal pain, back pain, shoulder pains, etc. My job is to help you get well, not just get rid of symptoms. If you want to get rid of symptoms, take a pill to get an injection, but that's not going to make you healthy. So what we're going to discuss, how do you have your ligaments, tendons, and muscles work for you? The muscles are going to move your joints and they will guard and protect you. Tendons are attachment sites from the muscles across the joints, and the joints themselves are held together by ligaments. Now, analogous that we can see is going to be a Chinese finger puzzle. It kind of holds things together. If you get a chicken bone, a thigh and a leg or whatever, you try to pull it apart, you actually pull the bone out of the joint. The joint does not come apart. Now, in life, we're going to walk around and we're going to eventually traumatize these ligaments. When you traumatize a ligament, it's going to rip and tear and bleed. If you bleed on the outside, we call it a cut or an abrasion or a contusion. On the inside, we call it bruising. But when these ligaments tear, they don't tear nice and neat. They're going to be frayed and frazzled and not cut like a cut will be nice together. You put it right back together. These you can't weave back together. So the body has got to go in and repair this. The repair of this damaged ligaments is going to be done with scar tissue. So scar tissue are little like band-aids that are put across this whole area. Wherever you have the trauma, it's going to connect one side to the other side, holding it together. So it's a bunch of interwoven, interlocking pieces of sticky, gooey things that will congeal. Now on the outside of the body, we call that a scab. On the inside, we're going to call it repair tissue or scar tissue. When it's on the outside, that scabby scar tissue builds up, puckers up, and gets real hard. Research tells us that the ligamentous tissue that's analogous to the scab is going to be somewhere between 4 and 40% normal strength and elasticity. Elasticity means it's not going to bend. Now likewise, the scab on your knee, you bend your knee, it's going to break it back open, and you're going to re-traumatize that tissue that then has to re-repair itself with new scar tissue being laid down upon that. So it gets bigger and more bulbous on the inside. Likewise, on the outside, the scab on your knee will shrink and contract and get bigger and more stiff and brittle. Same thing happens on the inside. On the outside, though, that scab will eventually fall off and you got brand new tissue underneath. That brand new tissue is kind of tender. It's not normal yet. Likewise, on the inside, with the scab there, we must rehabilitate that because the scab doesn't fall off. It will stay there. Research tells us that this tissue is somewhere between 4 and 40% normal strength and elasticity will go through this cycle of injury and repair, injury and repair, injury and repair. What we have to take a look at in our office is how can we get you out of that cycle and get it normal, healthy tissue again. If we will do rehabilitation or exercises on your own and some guided by the doctors, research tells us with rehab you can get up to 94% normal strength and elasticity, so almost as good as brand new. Now what is required of that? It takes 12 to 24 months to get there. With a brand new injury, 12 to 24 months later is going to be normal. With old injuries upon old injuries upon old injuries, we don't know, nobody has done research for that. But research does tell us that if you don't do the rehabilitation model, you're going to develop into arthritic and chronic pain states. You will develop bone spurs. Bone spurs are nothing more, and arthritis is nothing more than scar tissue gone bad. This scar tissue keeps building up and getting knottier and still having that 4 to 40% strength problem. And the body says, I'm going to strengthen by putting calcium into that. And this is where we get the bone spurs from. The body is putting calcium into bad scar tissue. To stop that, we have to go into a rehabilitative state. Research has shown us this is what's going to happen. Now, contributing factors to develop the arthritic state and the chronic pain state more readily is going to be a standard American diet, which is not a good diet. I hate to tell you that the old hippies are right. We need the raw fruits and vegetables and staying away from the other stuff. And anything that's processed can be deadly for us. A sedentary lifestyle, sitting around, research has shown that a sedentary lifestyle is more detrimental to our health than is smoking. And everybody knows how bad smoking is for our health. So a sedentary lifestyle is worse than smoking. That kind of needs to sink in. What that does here, though, is allows this to continue and accelerates the arthritic changes. limited motion, such as you get up, you drive to work, you sit in your desk, you drive home, you sit in front of the TV and watch things. That's what's going to cause us a lot of problems. So we've got to get motion and mobility back into us. So in closing, I want you to understand what is necessary for you to get healthy and well. If you've been in a chronic state of having difficulty, pains and patterns, weaknesses that have been bothering you for a long time, there is a reason, and this is going to be it. We can help you with that if you'll come in. And what we've offered to patients, public to do, what we have offered the public is to have you come in. We'll do a free consultation evaluation on to see if you are a candidate for this type of care. If you're not a candidate for our care, we will refer you to somebody that would be able to help you. If you'd like to find out if we could help you with this type of approach on your chronic pains or even current pains, please give us a call at 817-282-7600. You can also look us up on the internet at our website at activehealthcare.us or on my Facebook page, Active Healthcare. Please give us a look-see and let us see if we can help you.